Hello and welcome to Pancreatic Cancer Warriors. I'm Dr. James, and today we're going to address a critical question that causes a lot of confusion. Does pancreatic cancer always cause jaundice? No, it absolutely does not. While jaundice, that distinct yellowing of the skin and the whites of the eyes, is one of the most well-known symptoms associated with this disease, it is far from a universal sign. Believing that jaundice must be present for a diagnosis to be considered can lead to dangerous delays in seeking medical attention. The reality is much more nuanced, and whether or not a person develops jaundice depends almost entirely on the tumor's precise geographical location within the pancreas itself. Understanding this is key to being truly vigilant about your health and recognizing other, more subtle signs. To understand why, we need to look at the anatomy of the pancreas and its surrounding structures. The pancreas is often described in three sections: the head, the body, and the tail. Jaundice occurs when there is a buildup of a substance called bilirubin in the bloodstream. Bilirubin is a yellowish pigment produced by the liver during the natural breakdown of red blood cells. Normally, the liver releases bilirubin into the common bile duct, which acts like a pipeline, carrying it through the head of the pancreas and into the small intestine, where it is then excreted from the body. Jaundice happens when this pipeline gets blocked. If a tumor develops in the head of the pancreas, the widest part of the organ, nestled in the curve of the small intestine, it can grow and physically press against or invade this common bile duct. This compression effectively creates a dam, preventing bilirubin from flowing out of the liver. With nowhere to go, the bilirubin backs up and spills into the bloodstream, circulating throughout the body and depositing in the skin and eyes, causing them to turn yellow. Because the bile duct is so narrow, even a relatively small tumor in the head of the pancreas can cause this blockage, making jaundice a relatively early and very noticeable warning sign for tumors in this specific location. However, the story is completely different for tumors that arise in other parts of the organ. Tumors located in the body, which is the middle section, or the tail, the thinnest end of the pancreas that points toward the spleen, are anatomically distant from the common bile duct. They are situated too far away to exert any pressure on it, especially in their early stages. Consequently, these tumors can grow quite large and even spread to nearby tissues or distant organs without ever interfering with the flow of bile. This is a primary reason why cancers of the pancreatic body and tail are often referred to as silent tumors. They don't typically trigger the early, dramatic alarm bell of jaundice. The symptoms they do cause are often more vague and easily attributed to other, less serious conditions, which unfortunately allows the cancer to advance undetected for a longer period. Therefore, it is absolutely critical to understand that the absence of yellowing skin and eyes does not, in any way, rule out the possibility of pancreatic cancer. A clear complexion is not a clean bill of health. It might simply indicate that if a tumor is present, it is located in the body or tail of the pancreas rather than the head. Relying solely on the appearance of jaundice as the definitive sign to seek help is a common and potentially tragic misconception. This is precisely why awareness of the full spectrum of potential symptoms is not just helpful, it's life-saving. You must empower yourself with a broader knowledge base to become your own best advocate. Because tumors of the body and tail often don't cause jaundice, it is crucial to be aware of the other warning signs that can signal a problem. Pay close attention to unexplained and unintentional weight loss. If you're losing weight without changing your diet or exercise routine, it's a significant red flag. The new onset of diabetes, particularly in someone over the age of 50 who is otherwise thin and has no family history of the disease, can be an early indicator. Persistent, dull pain in the upper abdomen that may radiate to the back is another common symptom. Also, watch for changes in stool, such as pale, greasy, or foul-smelling stools that float, a condition called steatorrhea, which can indicate the pancreas isn't producing enough enzymes to digest fat. Loss of appetite, nausea, and persistent fatigue are also on the list. If you experience any of these symptoms, even in the complete absence of jaundice, it is vital to speak with your doctor and specifically mention the possibility of pancreatic cancer. I hope this has clarified the complex relationship between pancreatic cancer and jaundice. Remember, knowledge is your most powerful weapon in this fight. This is Dr. James from Pancreatic Cancer Warriors, encouraging you to stay informed and stay vigilant.